questions you asked us, and then I'm here to answer.
Awesome. You ready?
Yep, I am.
Awesome. Cool. Would you say it takes about a month for the results?
Yes. So the infusion itself is about month long, 6 infusion over 4 weeks. However, younger you are, the faster the result you start seeing. Typically, after third infusion, you start to notice the effect. The older you are, it takes a little longer for your body to get adjusted with the neurotransmitter and then the new neurogenesis to happen. So the oldest patient we treated was in their 70s, and then it took about a month for her to feel the full effect of medication or results of the therapy.
Cool. Would you say it's a safer route than relying on anxiety medication?
Yes, absolutely. So when you get the ketamine in your IV, it replaces your neurotransmitter. It doesn't give you band-aid effect. It touches the root of the problem. So let's say if you were having a low neurotransmitter, it replaces it. At the same time, during the psychedelic effect that you feel, you actually figure out subconsciously what happened to you in the past, and you do have a ketamine integration coach to talk to afterwards, after the infusion, and we give you 2 hours of therapy. So
Definitely sounds safer.
yes, yes.
Awesome. Any negative side effects that I should know about?
So if you have hypertension, high blood pressure, you would have increase in high blood pressure during the ketamine, and tachycardia, which is increased heart rate. So those are common side effect, and nausea. So we give everybody anti-nausea medicine before they start, and we actually also treat the blood pressure if it's too high. We check your blood pressure every 15 minutes. You're going to be connected to a heart monitor that checks your heart rate at all times.
Okay. I feel like you kind of went into this a little bit in the first question, but the next one is, what does ketamine do? I thought it was a drug.
It is a drug. It is a drug. We use it in anesthesia commonly. We would use it during trauma, or we also use it during pediatric patients population, because it's very safe anesthetic where it makes you not remember anything. In the high dose, anesthetic dose, it makes you feel no pain, and it's a very safe medication where it never stops you from breathing. So when we're giving ketamine in the office setting to diagnose mental health disorder, we use sub-anesthetic dose, which means 0.5, 0.6 milligram per kilo, versus anesthetic dose that starts with 2 milligram per kilo, which is pretty significantly high dose.
Okay, so the next question actually was, what dose do you start a patient on? So
Okay.
Do you want to just repeat it one more time?
Sure. So in our clinic, we start everybody on 0.6 milligram per kilo, and we do actually go up on each time when you come in. Depending on how you tolerate and what you experience, we titrate the dose based on how you feel. Not everybody needs to go up. Not all diagnoses are same. Not everybody's same. So we adjust it based on you.
Okay. How high functioning are you after an infusion?
So it takes about 15 minutes for you to get back to your normal self, and we definitely don't want you to drive afterwards.
I was going, no driving allowed. We will walk you downstairs and watch you get in your Uber. That's how safe and serious we take these measures to make sure you don't drive, because you don't want to get into car accident. And also that day I would recommend taking a nap, just taking it easy. Don't go to work. We actually encourage you not to work afterwards. Also not sign any big contracts.
Yes.
Spend millions of dollars on the lottery. You're going to feel really good, but...
Don't get married. Don't get divorced.
Yes, exactly.
Don't buy a car or a house.
Or quit your job. Just wait until the series is over, because you're going to feel really good. But, we want to take it one infusion at a time.
Yeah.
Awesome. Another question, is it supposed to reset you after a full course, or will you need to go back for further treatment later in life?
So it all depends on a diagnosis you have. So let's say somebody who has a chronic depression, their body was missing neurotransmitters, so we replace it, but eventually you may need to get a booster. Let's say if we are diagnosing anxiety disorder. So the pathophysiology for diagnosing and treating anxiety is different than depression. So most likely there is a neurogenesis occurred. So you have ability for your thought process to go through different pathways. So you're able to deal with your anxiety differently, and less likely you're gonna need to have a booster. For somebody who has PTSD, typically during this 6 infusion process, your PTSD resolve. So less likely you'll need to have a booster. But it all depends on how you feel and what diagnosis we're treating. And not all size fits everybody, so we have to talk to you. We educate you on regarding what to watch out for your signs and symptoms, and then you would have to give us a call when you need to get a booster. We try to make you you're the leader of your patient care in this process. We want you to be active participant of this treatment.
So this was a question actually asked for a patient who was undergoing ketamine infusions right now in a different office. I believe it was in Oregon.
Okay.
She said, I had my 3rd infusion out of 6 and I'm still not feeling that great. After each infusion I'm exhausted. Is this normal?
Okay. So the exhaustion comes from if they add magnesium in the fluid with ketamine. That usually tends to make you feel like that. Magnesium is a co-factor for ketamine to bind on the NMDA receptor. So when they use that, the ketamine on NMDA receptor stays longer, therefore your glutamate neurotransmitter goes up. So that's common if they use it. I don't know what they use. Also, not everybody is the same. So if you haven't felt better after your 3rd infusion, depending on what medication you're taking and how old you are, it will vary time frame. So most commonly we've seen the younger the patients, let's say in their 20s, they feel the effect of the medication by 3rd. When they're 40s, 50s, usually 4th or 5th, and then the oldest we've treated patient was in 70s, and then after 6th infusion she didn't feel better, but we knew it took longer, so we told her okay, have faith and keep journaling, start doing small things in your life to improve your mental health. So by 4th week, she actually felt better. She was actually getting up, getting out of the house, golfing with her husband. So, everybody's different.
Definitely. I feel like I heard this once. It was like the medication, or the healing is kind of within yourself. The medication's within yourself. So, awesome. So, you kind of already answered this, but can I go to work after my infusion?
No, we don't want you to.
No. And you're not going to want to either.
Yeah. This is the time you're actually taking it to spend it for yourself. So I would encourage you to plan things accordingly, so that way you can spend that quality time with yourself and just not rush into anything, because as soon as you finish your infusion, we don't want you to feel like, oh, I gotta go to work. Starting June, Mondays and Wednesdays, we're gonna stay open later in the day because we've gotten a lot of patients asking, hey, can I come here after work? So we're trying to accommodate for those people who are working.
Yeah, definitely. That's awesome. So when doing ketamine infusions, are the effects immediate for someone not taking any medications compared to someone taking medications?
Yes and no. So if somebody, it's situational, yeah. If somebody who is taking benzodiazepine, which is a drug of medication including Xanax, Ativan, Klonopin, those are medications that covers your GABA receptors. when the GABA receptors are covered, when ketamine comes in your system, you don't feel the strong dissociation or psychedelic effect that you feel. For somebody who wasn't taking any medication, they would feel the psychedelic effect immediately or more intense. So patients who are taking benzodiazepine, they will still feel the psychedelic effect, but we do have to give those patients higher dose to overcome that blockade of the receptor. So that's why it's really important for our patients to call and have an appointment with the anesthesia providers, because we go over the medication and then we make judgment call where what dose we need to start, and then we'll tell you what not to take, what to take at night before your infusion.
Okay, cool. I'm specifically interested in what it takes to qualify for this, if insurance covers it, and what is the cost.
Okay. Well, unfortunately, insurance doesn't cover it. Ketamine is an anesthetic. When we use it for mental health diagnosis, insurance says they won't cover. To qualify for the treatment is basically you do need to have a referral from psychiatrist or family practice doctor who's been treating you. And if you don't have any of these providers, we do have psychiatrists that we work with. You can call and get referral and consultation. And this is a drug that known to be abused by many in the 70s. Yep. So we just can't give ketamine to people who just call us. They need to go through the screening process. Definitely. And make sure qualify for this treatment. And it is all out of pocket expense for now. Mm-hmm. Hopefully it'll cover, be covered by insurance.
And there are a lot of situations where the provider will kind of be resistant to it. We're more than happy to get on a call with them and kind of discuss it with them. Majority of the time it's because of ignorance. They just aren't aware it is a new coming type of therapy. So we're here for you. We'll make it happen. And if you do want to get that referral form, it is on our website under providers. So you can download that there after you watch this video. Awesome. So let's see. How spaced out should the infusions be?
So it's 6 infusion over 4 weeks period. 2 infusion a week for first 2 weeks, and once a week for last 2 infusions. The reason we do that is that's when the best outcome transformation happened. When we used to give infusions within 2 to 3 weeks, a lot of patients felt like it was rushed. They felt increased anxiety in between each infusion, so we wanted to accommodate all of our patients. And then we've seen amazing transformation with this schedule.
Awesome. Okay, I'm scared I'm going to have a panic attack during my infusion. Is that common, or do you have anything that would potentially help if that happened?
So typically when patients who have panic disorder or anxiety, you're going to feel increased anxiety regardless of what you're going to do. So we try to educate you as much as possible. We send you a lot of reading material. We send you YouTube links that you can watch other people and what the setting is. So we try to educate you on as far as everything you need to know. And when we educate our patients, so far, nobody ever had panic attack because they felt really comfortable coming in because they read and learned about everything they need to know. We do have a medication to stop the effects of ketamine in the office. Since we started our clinic in 2019, we haven't used once.
0.
Once. And
that speaks for itself, I guess.
Yeah. So if we need to, we'll use it. If not, we don't. So.
Yeah. Awesome. So this next question was, can you please send me some more information? We do have plenty of information on our website, which will be provided below. This person has depression, anxiety, which happen to be, one of the main things that we treat. So they want to stop taking medication. Do you need to be prescribed this treatment, or can you essentially walk in? There are some centers around me in DC. I would love to dive in. Do you mind if I?
No, go ahead.
So I guess the only thing I have to really say about this is do your research on the clinics around you. Here in South Florida, we have experienced some patients coming to us from different offices where their protocol wasn't as in depth as ours. Just make sure you educate yourself on what's important.
Yeah.
We'll definitely be producing some videos that will show you what to look for in ketamine clinics around you, because I really think going to an office that requires a referral is very important.
Yeah.
Going to an office that has an integration coach is important.
Yeah. Also, having an anesthesia provider on site, because ketamine is anesthetic. You want to be, you want to have somebody who knows what to do in case of an emergency. I believe some of the clinics in South Florida is actually just overseen by nurse practitioner who hasn't been properly trained to administer ketamine. So we have received a couple patients from their office, and I just felt that was very unsafe, because I work in the hospital when I'm not here in the clinic, and I give ketamine pretty much every single time if my patients can benefit from it. So you
You're
just want to
in this particular drug,
so you just want to ask those questions, and also calling in a office and just walking right in seems pretty dangerous to me, because we ask you not to eat anything for 6 hours before coming in, because if you have a full stomach, you get ketamine, you could feel nauseous during the infusion and afterwards, because you're going to be not being able to drive. So that just adds extra stress for your treatment. So we educate you on everything you need to know, and we prevent all the adverse side effects: nausea, hypertension, tachycardia, and then typically patients may have headaches. So we actually give Toradol IV, which is IV version of ibuprofen. So we prevent the headache. So we've been doing it for a while, so we know what to look for, and then we just treat it. Our goal is to preemptive treatment versus catching up when already patients having symptoms. So
of course, I love that.
Yeah,
I love that. It's amazing. Definitely really important to it's money is when it comes to your mental health. You want to make sure you're getting the best care possible. So
yeah, and also we've been running this clinic for a while, and we ask our patients what worked for them and what didn't work for them. So we always consider their opinions too, because they're the one who's sitting on this chair, and they're basically essentially giving up their control to us, trusting us to take care of them while they're getting the infusion. So we want to earn that trust and provide them the best treatment as possible.
Awesome, Khali. Well, the other questions are kind of what we've already answered. Pricing you can find on our website under pricing, but I can't express it enough. It's definitely important to find a clinic around you that follows a protocol similar to ours. I feel like we definitely cross all the bases in regards to safety for us and for the patient. Thank you, Khali, for taking the time to answer these questions. And thank you guys. Don't hesitate to blow up our DMs all the time. We're more than happy to create as many videos as you'd like to answer your questions and educate you, because that's ultimately what it comes down to, is educating. So.
Yeah, educating. Yeah. Well, thank you for having me.
Thank you.